disease of addiction doesn't go away just because you stop using drugs. So many people get confused about that. I had a patient who came in and he had been in rehab like 3 times before, and he had made it maybe 6 months maximum where he had stayed off drugs. And he came in and he wanted me to detox him. And at the time, I was using long-acting naltrexone implants that could keep him completely safe and have no cravings for 2 months. Um, and he wanted me to detox him, but he did not want to go to any rehab. He didn't want to stop smoking pot or doing other drugs. Didn't want to stop drinking alcohol. And um, in the end, I had to say to him, I can't help you because you're going to relapse. You're not going to, your disease isn't going to go away just because I get you off the drugs and give you 2 months of clean time. I mean, you've had that 3 times before, and you failed every time. That's like somebody going to jail for 3 months and getting out and thinking the disease has gone away. It just doesn't work like that. And after a while, we talked and we ended up agreeing that I would put him on some Suboxone. So we put him on Suboxone over a 3-day period, and he went back home and followed up with a local doctor. And I said, look, when you're ready to make some changes and actually stop everything and get fully into recovery, then we can help you. But otherwise, it's just too risky because your disease won't have gone away just because you stop using. People get confused about the difference between physical dependence and the disease of addiction. It's important distinction. Physical dependence will happen to 100% of people if they get put on any kind of addictive drugs. It even happens if people get put on prednisone or steroids. Their body gets used to it. It's a process we call homeostasis, where the body and particularly the brain gets used to the drug that people are taking, and it stops making its own natural chemicals, its own natural neurochemicals. And then when the artificial ones that people have been taking aren't there anymore, then they go through withdrawal. That'll happen to 100% of people. The disease of addiction only happens to about 10% of people. That seems to be caused by a genetic vulnerability combined with some trauma that sets the brain up, and then drug use uh, kicks the disease into gear. But it only happens to about 10% of people. Other people are able to use drugs, alcohol, or other drugs socially and not get into any trouble. Um, the best way to sort of illustrate this is to give you a couple of examples. Uh, First of all, thinking about people who have physical dependence, but they don't have the disease. And my patient Wanda was a good example. She came in with a broken wrist, and she'd fallen and had what's called a Colles fracture, and it was very painful. And so her orthopedist had put her on Percocet, as he should have, and she was taking this drug 4 times a day, and ended up taking quite a bit because it was very painful. And I thought, oh boy, here we go. She's going to end up wanting more and more drugs. She's going to come up with excuses and lies about why she wants more, and she's going to turn into a drug addict. But she didn't. She came in after about 2.5 months, and I said, how are you doing? And she said, well, I'm great. I said, what happened to your drugs? She said, oh, I threw the rest of the bottle away. I didn't need them anymore, so I stopped taking them. She was physically dependent when she was taking those drugs, but she hadn't turned into a drug addict. We see that all the time with chronic pain patients who are on opioids. They're physically dependent because they need them because of low back pain or other chronic medical conditions. Their life is enhanced by the drugs that they're taking, the opioids that they're taking. They don't escalate their drug. They don't come up with excuses. They don't develop any of the negative consequences. They don't they don't have any trouble controlling it, so they don't have the disease, even though they are physically dependent. We see the exact opposite, where people have the disease, but they're not physically dependent. Alcohol patients are often like that in their early 20s. I've had many patients who were severely alcohol dependent or alcoholic, and they had DUIs, they had fights, they had falls, they had all sorts of negative consequences, but they weren't physically dependent. Uh, Second group like that would be binge alcoholics. So we see people who might only drink twice a year, but when they do, they get in huge trouble. They know they're trying to control it and they're trying really hard to control it. And then some stress comes along or something, and they decide to have a drink or two and they can't control it and they lose control and they do all sorts of horrible things and they end up with negative consequences. But right before the binge, they weren't physically dependent. Uh, we see people who are in jail and they get out of jail and they're not physically dependent because they've been in jail for 6, 8, 12 months, 2 years, but they're back using again within 2 or 3 days. So they're not physically dependent at the time they go back out of jail, but they still have the disease. We see, and people in long-term recovery are like that. They might have 5 years of recovery, but if they make some mistakes and they lose their sobriety, they are right back where they were before. So these are people who have the disease, but they're not physically dependent. So I hope that helps explain the difference. And now medically, we have a much better idea of how the brain works. So we know that the reason this happens is because the drugs have caused an injury to the brain, part of the disease process in those vulnerable people, those people who have the genes and who have had trauma. Once they start using drugs, the drugs cause changes in their brain, and we'll talk about those in later videos. And those changes last a long time, if not the rest of their lives. So there's more and more evidence of what those changes are that cause the brain to still be vulnerable to go right back to addictive, negative consequence drug use if people do fall off the wagon and go back to using again. So that's how people have the disease. It doesn't go away just because you get clean and sober. You have to be careful the rest of your life to not relapse and not go back to using.